Hello everybody, good evening, welcome to Neonatal channel. Today we will speak about basic life support in neonate and child. Okay, here we will check the child from 1 year to 14 years. From 1 year to 14 years. If the baby below 1 year, it's neonate. It is neonate. Okay, so neonate from birth to 1 year. Okay, so here the first thing we will do, you will check safety of the baby and safety of you. Okay, because you are the rescuer. If there is harm of anything harm for you, so you can't give him support. So you must first check the safety. Then you will check the baby, check response of the baby. If he is baby or more than 1 year, you will check him. Hey, how are you? You are good. If he cry, if he didn't speak, if he cry, and if he do anything, so he have response. If he didn't cry, so this baby have no response. What is the neonate? If he is neonate, you will check the bottom of the foot. The bottom of the foot. You will scratch his foot like this. So if he have any response, he will pull his foot, or he will cry, he will do anything. So if any response, so he will move. If no response, second thing, you will check breathing by ABC. Why ABC, not CAB like the adult? Here, the most common cause of arrest in the child is airway obstruction. So we will check first airway. Okay, in child we will check by head tilt, chin lift, or just rest. Okay, in the neonate we didn't do like this. We didn't do head tilt, chin lift because the baby neck is small. So we will keep the baby flat and check open his mouth if there is any obstruction or anything in his mouth or no. Okay, next thing is breathing. We will check breathing by look, listen, feel. Look his chest if there is any chest rising or no. Listen to sound of breathing, if there is any sound of breathing in the breathing or no. Feel if there is warm vapor from his mouth or no. All of this process, airway, breathing, circulation, we will check in 10 seconds. Okay, circulation in the child we will check by carotid pulse, but in neonate we will check by brachial pulse. Okay, then if there is no breathing, no circulation, no any response from the baby, we will give this baby to breathe. We will give first to breathe. Okay, we will open his airway and then give to breathe. Then we will start CPR. We will start compression. Okay, by 15 to 2, 15 compression to 2 breathing, 15 to 2. This will continue for 2 minutes or 5 cycles. 2 minutes or 5 cycles. Okay, after compression, then we will call help and bring AED. Okay, the compression here in the child, as we know, the child not like the adult. In the adult, we know that we will do compression by both hand. We will put interlocking hand like this and push the chest of the baby, of the adult. Here in pedia or in child, we will use one hand only, one hand CPR. So we will put one hand on the chest of the baby over the sternum. Then the push from the shoulder, we will push the shoulder from like this. In neonate, we will use two fingers. In neonate, we will use 2 fingers. Okay, so we will put the fingers like this on the chest of the baby. Okay, so we will push like this, or we will use the both of thumb. So we will support the back of the baby by both hand and put the thumb on the chest. So we will compress by the thumb. Okay, this is the compression. Then we will call help and bring AED. When we check if there is no pulse, we will continue CPR again. If there is pulse, we will put in recovery position until the team of ACLS attend for you, or if you are in the home or you are in the beach or anything. Okay, so you will wait for the ambulance when the ambulance came. Okay, as we said, compression in child by one hand, compression in neonate by thumb or both finger. Okay, today we'll finish our lecture today. If you found this one is good, please don't forget to subscribe and share. Thank you.